Hello, my name is Dr. Robert Gish. I am sorry not to be present for your wonderful event this evening. I'm dialing in today from San Diego, where I live. I'm a clinical hepatologist, and well, I think you may be asking yourself, why this shirt? I just returned from a 2-week trip to Africa working on liver health. This trip was really focused on hepatitis B. I'm a hepatologist, that's a liver specialist. I have 5 offices in California and Nevada, and also a global office where I do telemedicine around the world. And really, my life is focused on promoting liver health. I'm going to talk about a few different liver disease states and what I'm doing in partnership with the Hepatitis B Foundation. Michael and Jean are close friends and colleagues, and of course, we're working together to improve knowledge in your community, around the country, around the world. Let's talk about a few facts. Hepatitis B, a chronic infection that's incurable but treatable, kills 2 people every minute. Hepatitis C, another chronic infection that's curable, is killing about 1 person every minute around the world. And the other 2 forms of liver disease that are dominant are alcohol-associated liver disease and fatty liver-associated liver disease. We're trying to change the world by changing people's behavior. Much of this is preventative through health education and what we call harm reduction, having people make the best choices. I have worked in another condition called primary biliary cholangitis. This is an autoimmune disease. This used to be called cirrhosis, but most people didn't have cirrhosis. So I and a number of my colleagues changed the name from primary biliary cirrhosis to cholangitis to take away stigma, to take away discrimination. All forms of liver disease should be destigmatized. Let's go back to the Africa story for a moment. I just hired one of my colleagues to help me on what I call the Smile Coast of Africa. This is the west coast of Africa, starting in Benin and going all the way up to Mauritania. I spent 2 weeks in 7 of these countries this last spring, educating each day in one of the capital cities over 2 weeks on a boat trip. Heavy focus here is about getting vaccine, testing, and treatment to the community to prevent this very, very serious disease that's the most common cause of liver cancer worldwide. By testing, vaccinating people who don't have infection, we can prevent cancer. By treating people with infection, we can reduce cancer risk by about 70%. So that's absolutely amazing. What we want to do with your help is to take this message to the community about liver health, making healthy choices, keeping people's weight down at a healthy body mass index. If people have chronic liver disease, they shouldn't drink alcohol. If a person's otherwise healthy, we have an alcohol message in moderation. I do want to welcome my colleagues here also from the Hepatitis B Foundation who help me work worldwide. And there's other individuals in different foundations working in these other disease states to try to change the world. Hopefully we can change the world together with you.